Very much for having me, and great meeting, Jim, and I wish this existed 5 years ago when I was a senior trainee. So I'm going to talk about the female ACL, talk a little bit about why women and young girls are 3 to 6 times more likely to injure their ACL. In case any of you aren't aware, we have actually known about this for decades. So it's come to the forefront recently with the success of the Lionesses at the Euros and the World Cup, but we have actually known about this for a really long time, but we don't have many of the answers yet. So I'll talk about what we do know, and a little bit about what we can do to prevent some of these injuries and what's next for women's ACLs. So I think a lot of people are familiar with some of the biological reasons for women being at higher risk, and some of these have been covered in some of the previous talks. I like to think about the difference in women's ACLs as divided into reasons related to the female sex, so that's their biology, and then reasons relating to their gender. And I think that's a slightly less appreciated concept. And gender is the socially constructed role of being a woman in society. So your biology, that we're talking about your higher Q angles, your valgus, your narrow notches, and your hormonal fluctuations. We know that as estrogen levels change during the menstrual cycle, that can impact on ligament laxity and injury risk. And then when we talk about gender, we're thinking about the gendered environment, and this has been discussed in more detail recently by Steph Cohen and Joanne Parsons in some of their work with elite female athletes with the UK Sports Institute. What do I mean by the gendered environment? So this relates to women's injury risk experience and outcomes, and it doesn't discount the biological factors, but it does ask us to take a wider lens. And these images demonstrate an example of what I mean by the gendered environment. So this was leaked on social media at a US basketball event. And in the same club hosting the event, on the left you see the gym facilities for the men, and on the right you see the gym facilities for the women. And this is just a snapshot of what actually is in practice in both elite and grassroots when you look at the difference in facilities and resources between men and women in sport. And it makes logical sense that if you're going to invest in your strength and conditioning and your coaching, you're going to have lower risk profiles for injury. So that's one example of what I mean by the gendered environment. And then we've also got the fact that our football boots have been designed around men's bodies, etc., and lots of things that you might have seen in the media recently. So how can we reduce women's ACL injuries? We don't know a lot other than the fact that women are higher risk. The only hard evidence we have at the moment is that neuromuscular warm-ups for sport disproportionately benefit female patients. And this, again, has been documented in the literature for quite some time. So I think the earliest paper here that I found was from 2008. What do I mean by a neuromuscular warm-up? These are warm-ups and exercises that improve the communication and reaction between the nerves and the muscles. In some of the literature looking at neuromuscular warm-ups, we've seen reductions as high as 80% in female ACL injuries. And this relates to your prehab, preconditioning before play, it relates to strength and conditioning, and also physical literacy of female athletes. So I've borrowed this slide from the charity Power Up to Play, who I'll talk about in more depth in a minute, but this is just a snapshot of the UK picture of injury prevention at the moment. It's divided into our strategy as a country, the research that's going on, and then the intervention. And from a strategy perspective, the BOA has made injury prevention a big priority this year. Mark Bowditch, who's our new BOA president, has a real interest in developing this. So we have an injury prevention strategy group. From the research perspective, I sit on the Women's ACL Orthopaedic Steering Group. We recently undertook a Delphi consensus process to identify the research priorities in women's ACLs. We don't know where to start, and so we've identified our top 10 research priorities, and these will hopefully be released later this year. And our second highest ranked priority was about injury prevention. And then there's also going to be some work with the FA with a PhD and Project ACL, which is a research project being undertaken with FIFPro, who are the Professional Footballers Union. And then from the intervention perspective, we have the charity Power Up to Play. So if any of you haven't heard of Power Up to Play, I'm one of their ambassadors, and they're a charity that was set up by clinicians actually in response to the rise in ACL injuries in children and adolescents in grassroots sports. And they advocate for this neuromuscular warm-up. They advocate for there's a variety of warm-ups that clubs can take on, and it reflects the strength and conditioning work that's done in a lot of elite clubs, but it's scaled down to something manageable for grassroots clubs. And the particular warm-up that they will advocate will be the PEP, Santa Monica PEP program, because it's easy and reproducible. But it sort of makes sense that a lot of the work that they're doing is applicable because we've seen in the data that these warm-ups disproportionately benefit women, that this can be extrapolated out to our female patients as well. So this is what a neuromuscular warm-up might look like. So you've got your warm-up, your running section. There's these very distinct phases, a strength phase, the plyometric phase. And that's often the thing when I talk to patients about how they warm up for sport that is missed in traditional warm-ups. It's your jumping and landing control. And that's the thing that can really reduce our ACL injuries. And then you've got your agility, reproducing movements that they're going to take on in play, and then obviously our stretching session. And I just want to draw your attention to this paper. We've talked a lot about surgical technique for ACL, and I feel like I'm sort of raining on everyone's parade a little bit by telling you how to stop these injuries so you don't get to do as much fun surgery. But this paper was actually, again, relates to the pediatric ACLs. The IOC developed a consensus statement on management, but one of the things I came away from the paper that I found really interesting was they said that surgeons should be taking responsibility for injury prevention. So we are not just mechanics, we're not just surgeons, we're doctors, and we're responsible for these patients. We have a responsibility to help reduce these injuries, particularly considering that we have such good data saying that these injury prevention warm-ups work. So what's next for women's ACLs? So as we've identified our research priorities, and injury prevention is high on that list, and we will be proceeding with some of the other priorities in due course. I would like to advocate for all of those of you doing projects relating to ACLs. Everyone loves to pull out research projects relating to ACLs. Disaggregate your data according to gender. There have been recent guidelines from the SAGA group, the Sex and Gender Equalities Research Group, stating that if gender could influence your outcomes, you are obliged to differentiate your data based on those genders, because you will not get accurate results if you pool them all together. The other thing I'd really like to advocate for is collaboration, so not just across surgeons, work with your physios, sport and exercise therapists, all of those involved in the patient journey to improve our data collection and evidence base in this area. So in summary, please remember to consider the agenda and environment when working with these patients. Prevention is everyone's responsibility, and collaboration really is key moving forwards with this. And if anyone's interested in getting involved in Power Up to Play or becoming a local ambassador, you can get in touch through these handles. Thank you.